Good morning, Dr. Berger.
Good morning, everyone.
I know there are upcoming trainings, aesthetic trainings. Would you be kind enough to cover them and speak a little bit about why did you come up with those trainings?
Of course. So I'm Dr. William Berger. This is Northeast Medical Practice. As you probably know by now, we are a concierge-style internal medicine, weight management, but also medical aesthetics clinic in Great Neck, New York on Long Island. Yes, I do a lot of medical aesthetics. We focus on injectables. So by that, I mean neurotoxin. Botox is a brand name, not the particular one I use. I use CNN, made by the Merz Corporation. But we do neurotoxin, and I also do dermal filler. I happen to use the Restylane brand, but there's Juvederm and many others, all good products. I don't have any particular financial relationship with any of them other than I use them on my patients because I trust them. So I get a lot of inquiries from other clinicians who know the kind of work that we do here in the clinic and are interested in learning to inject neurotoxin and filler. But my concern is always, how is an injector trained? When I went through training, I did it one-on-one with the best people on Park Avenue, as well as in Toronto, Canada, and really the top-notch places to train. And again, this was one-on-one. I would be with the physician who was training me. We would spend time learning anatomy. We would then learn the techniques demonstrated on a model by the physician. And then under the physician's close supervision, I would learn the techniques of injecting the patient. This was many, many years ago, but this is still the best way to train. This is exactly what I'm offering in my clinic.
And what are the prerequisites?
Yes, so this is going to be available to doctors, nurse practitioners, and PAs. So MD or DO physicians, physician assistants, or nurse practitioners. So people with medical licenses whom I feel are suitable to learn these kinds of techniques and procedures.
Can you talk about the dates and what exactly are you planning to cover?
Yes, so I'll talk about what I'm going to cover and then give the dates at the end. So at the beginning of each training, and they're on separate days, basic neurotoxin is one day, and basic dermal filler is a week later. What I want to do is concentrate on anatomy for at least the first hour. So we're going to go through some detailed didactic training on facial anatomy. For neurotoxin, we'll focus on the muscles because that's what we're looking to weaken so that people can't wrinkle their brow and so on. So you're going to learn a lot about the muscles of the face, the muscles of facial expression primarily. And on the dermal filler day, we're going to spend at least an hour going over the anatomy of the face with a focus on blood vessels and nerves, because these are the things to watch out for. You must know where they all are or where they're likely to be, because honestly, every patient is different and people have what we call anatomical variants of the position of various vessels and nerves. So you need to have a knowledge of where they usually are, ideally a way to detect where they are and avoid them, because we don't want to damage blood vessels or nerves with dermal filler. So this is why really one-on-one intensive training like this is important. You'll have the opportunity to watch me inject on usually 1 or 2 models, and then we'll have an additional 3 to 4 models that the trainee is going to work directly on with their own 2 hands under my direct supervision. So again, the first day is basic neurotoxin, and that's going to be Saturday, the 27th of September, 2025. And we'll start at 9 a.m. We'll spend time learning anatomy, and then we'll spend the rest of the day learning to inject toxin. The following week, Saturday, October 4th, also beginning at 9 a.m., we'll start our didactic session on basic dermal filler, and you're going to learn also how both toxin and filler work, the mechanism of action and so forth, in addition to the anatomy. I should mention that. Again, I'll demonstrate on models, and then we'll have other models who are coming in to get treatment. And we're doing this essentially at cost for our models, by the way, and we're recruiting models. So if anybody watching this is interested in being a model and receiving high quality treatment at a very, very low price compared to what you would ordinarily pay at my clinic or anywhere else, frankly. Our prices are quite competitive relative to others, if I'm being honest. So that dermal filler training, again, is Saturday, October 4th, starting at 9. We'll do mechanism of action and anatomy for at least an hour, and then you're going to learn to inject filler. I'm going to offer more advanced courses going forward. but these are the first two, and they're the basic injectables courses that I'm going to offer.
Will you provide any kind of certification or?
Yes, I'll provide certifications upon completion of the course, assuming that you do complete it, and that I have faith that you know the basics. This is by no means, in my estimation, a reason for you to go out and inject without further training because you've completed the basic course. Again, this is basic, and in order to really become expert, you need a lot of training. This is how I did it. This is how I think it should be done before you actually treat patients independently, because just like any medical procedure, you want to be highly trained in it before you're doing it independently on a patient so that they're safe and frankly, so your license is safe.
And you're also going to teach what to do in some critical situations, correct?
Yes, I should mention we're going to go over, of course, contraindications, the patients in whom you should not perform these procedures and use these materials. And also, I will go over what to do when there are complications. The most serious complication being one potentially with dermal filler, which is vascular occlusion, meaning you block an artery with a filler, and then everything downstream from there is no longer getting blood, no longer getting oxygen, therefore. So that, but of course, there are other potential complications, drooping of the eyelid with forehead Botox or Botox, neurotoxin, I should say.
And I heard blindness as well, right? It's
related to vascular occlusion if the dermal filler goes backward to the ophthalmic artery, the artery that supplies blood flow to the eye. Of course, I'm going to go over all of this in detail and teach you what to do in one of those kinds of emergency situations, because vascular occlusion, not an emergency and you must act in seconds, but you need to know what to do. You need to be calm and you need to know how to address it in a timely manner. But we're going to go over this much more thoroughly during the course.
so September 27th for
At 9 a.m. for neurotoxin, beginning with mechanism of action, anatomy, contraindications, complications, etc., all of the didactic learning, and then me demonstrating on models, and then the trainees getting the opportunity to learn the techniques
and practice.
on 4 models themselves under my direct supervision. October 4th, these are both Saturdays, 9 a.m. to begin the didactics on dermal filler and then learn to inject and so forth. And these courses are designed to really teach you the basics and have a fundamental understanding so that you can then go on to take additional training with me if you like, but you need to be properly trained before you're out there in the real world performing these techniques independently without supervision. It's just like training for any kind of medical procedure. You need to be safe.
And if somebody is interested, how can they get in touch with us?
Easiest way to call our office, 516-604-3418. Again, we're located in Great Neck, New York on Long Island, very convenient with parking, train and bus and so forth, all nearby. Or you can send a message through our website, northeastmedicalpractice.com. Or our social media channels, but honestly, you just give us a call at 516-604-3418 and speak to one of the members of our staff. Then we'll get you scheduled. We're only going to take 2 trainees per day, by the way. I should mention it, because again, it's one-on-one. This is not one of those courses where there are 100 people gathered around an injector and you're peering over somebody's shoulder to see what's going on, and you don't even get to put a syringe in your hand, much less perform the technique. So it's limited to 2 people. So I would suggest that you reach out sooner rather than later if you're interested. But I do hope to see a couple of you and help you learn how to do these techniques in a proper and safe manner. So until we see each other next time, be in good health.
Our phone number 516-604-3418.
That's right.